why sometimes after being successful, IVF results into miscarriage or fails later. So now let us understand how IVF works. What we do in IVF is we stimulate ovaries to grow multiple eggs in the ovary. We take out the eggs. Outside the body, we combine each egg with the sperm by a process called ICSI, and we make the embryos in the lab. We observe the embryos growing in the lab till 5th or 6th day when we get good grade blastocyst stage embryo. Once the embryo is ready, then we prepare the uterus and we put back the embryos. Now, why after being successful IVF fails, which means it may result into miscarriages, because there can be multiple reasons for miscarriage. Any pregnancy, like natural pregnancy also, there is around 3 to 10% chance of miscarriage. The same chance may remain even in IVF, and it may happen because of multiple reasons. Most common reason can be related to any genetic problem in the embryo. If your embryo in IVF is not PGT tested or genetically normal, you may experience a miscarriage because the embryo might be genetically abnormal. This is the commonest reason for miscarriage. Now, other reasons for miscarriage can be related to many things, including embryo quality or any health conditions like diabetes, thyroid, sometimes even women who have high BMI or very obese, because of their weight also it results into miscarriage. There are other medical conditions like autoimmune diseases, especially for women who have thyroid or diabetes. There might be antibodies which are present in the body, like anti-thyroid antibodies or also anti-nuclear antibodies and many other autoantibodies which may cause the pregnancy to end. So these are medical reasons for miscarriages related to any pregnancy, which is same applicable in IVF. Now there can be reasons related to your uterus, why it results in miscarriage. The reasons related to miscarriage can be any issues with the lining of the uterus. If the endometrial layer or the lining of the uterus is weak or very thin or has poor blood supply, then it may not be able to supply the nutrition required for the developing pregnancy, and it may result into miscarriage. Other reasons related to uterus can be some fibroids like submucous fibroids which are going inside the cavity, or there might be septum which is dividing the cavity and compromising the blood flow to the uterus and also the pregnancy. There might be reasons related to your cervix, like if you have cervical incompetence or dilated cervix, which may result into miscarriage. Also, most of the times patients may miss some symptoms related to infections like urinary infections and vaginal infections. If these infections are uncontrolled or not treated in time, it can also result into miscarriage. So now these are the multiple reasons why after being successful IVF may result into miscarriage. So if you have experienced a miscarriage after an IVF pregnancy, please consult a fertility specialist to evaluate the reason for your miscarriage properly, because the reason can be genetic, can be related to your uterus, it can be related to your medical conditions. Also, it can be related to autoimmune conditions where we have to accordingly treat the reason so that your IVF can be successful. I hope this was helpful.